Hello and welcome everyone to today's webinar on non-dilutive funding for non-US applicants. My name is Barda. I'm part of the business development team at the FreeMind Group, and I'm pleased to be presenting today's webinar, the fourth of the FreeMind Summer School. To learn more about the FreeMind Group, you can visit our website, freemindconsultants.com, and to keep up to date on the latest in non-dilutive funding, you're welcome to follow us on Twitter and YouTube, as well as join our LinkedIn group, Non-Dilutive Funding for Life Sciences R&D. My contact information will be available on the last slide of today's presentation. You are welcome to call or email me directly with questions specific to your situation or science. As I mentioned, today is the fourth webinar of the annual FreeMind Summer School, Non-Dilutive Funding for Non-US Applicants. Each of these webinars are or will be available on our YouTube channel, FreeMind Group, and I hope you will join us on Wednesdays throughout the summer as we bring you free weekly webinars on different areas of interest relating to non-dilutive funding. I will also be sending out an email with the slide deck from today's webinar. Please feel free to share it among your friends and colleagues. A little background on the FreeMind Group for anyone who may not be familiar with us. The FreeMind Group is a consulting firm specializing in non-dilutive funding. Actually, we're the global leader in non-dilutive funding, and our main objective is to help our clients get as much money as possible from non-dilutive sources. I will be speaking about several such sources during this webinar. We have close to 50 full-time employees and have been helping our clients in their quest for non-dilutive funding for 16 years now. We work with all players in the life sciences field, academics, research institutes, university medical centers, as well as companies from small startups of just a few people all the way up to large companies, including many large pharmaceutical companies, and with organizations not only in the US but from around the world. On behalf of our clients, we submit about 350 applications a year. That's a great deal of experience, knowledge, and expertise, which is all put to work for our clients to increase their chance of winning awards. So the FreeMind Group is basically a tool to help you maximize your non-dilutive funding potential. When we start working with a client, the first thing we do is identify the most relevant funding opportunities. This is a very important step. If you have great science, however you apply for a grant that's not relevant to your science, or you use the incorrect mechanism, you will not be successful, despite the fact that your science is really deserving of funding. Our analysts then create a list of opportunities and together with you, create a strategy, a multi-submission granting strategy, in order to maximize your chance of winning an award. We also manage the complex project's production process, and we lead a joint application writing process. We cannot do this alone. We do need you on board in this joint effort since you are the experts in your science. When relevant, we also support final contract negotiations. Just to give you a quick overview of industry's outline, 2014 was a really good year in comparison to several years prior. There's been a record number of IPOs listed, 133 new companies, and $11 billion raised. You can see that the NASDAQ Biotech is up 34% and S&P is up 23%, and the trend looks to be continuing into this year as well. VCs have invested $16.5 billion in life sciences, in comparison to only about $6 billion invested back in 2009-2010, so it's quite an increase in the past few years. The FDA as well has had an 18-year high last year with 41 new medicines approved. And of course, in our niche, in non-dilutive funding, the NIH has awarded $3.75 billion to for-profit organizations last year, and Department of Defense and other agencies such as Barda have also had record awards. I do want to point out that non-dilutive funding is not just the value of the actual dollar you receive. This is the most rigorous scientific review process in the world, and if you win an NIH award, suddenly investors are coming to you. According to a study done by Milken Institute in 2012, for every $1 received from non-dilutive sources, you will attract over $8 in the private sector. Another interesting fact that they found was that historically, 50% of all FDA-approved drugs have been funded by the NIH sometime during their development. This figure shows that if you're able to win non-dilutive funding, chances are this drug has a better chance of succeeding. This is an important thing to keep in mind as you move forward with investment and funding strategies and trying to successfully develop your new drugs and get your company going. Of course, this is not the only source of funding, and to build a strong company, you shouldn't rely solely on non-dilutive sources. You should have a diverse investment portfolio and be able to bring in money from different sources. Approach angels and VCs. If you're big enough, go to the public markets. But at the same time, keep strategically seeking non-dilutive sources to accommodate different aspects of your R&D needs. Conduct a balanced campaign when searching for funding. Now, one doesn't often think about the cost of raising money, but you can see here that average cost of raising money from private sources per year is between $60,000 to $120,000, and an investment of about 600 hours over the year, going to different events, presentations, seeking interest by investors, and of course, there is the cost of equity. Consider now the average cost of a non-dilutive campaign. Let's say 3 to 5 applications submitted over the course of a year, yielding the same amount of money, but costing you only between $30,000 to $50,000 if you hire outside assistance, and only about 300 hours of your time. And of course, there is no equity, completely non-dilutive with no IP issues, no royalty payments, no matching funds. Actually, as I mentioned earlier, you could attract investors. But please, again, don't think that I'm telling you not to go to VC money. But if you ignore this main driving source of funding, you will be missing out. Looking at a more specific outline of funding sources in the U.S., there's about $50 billion awarded every year. Under the Health and Human Services, the HHS, the main source is the NIH, National Institute of Health, with 27 institutes and centers covering every type of indication and population and every aspect of health science, including different branches of health and platform technologies. You can see here some examples of the institutes under the NIH, the NCI in cancer, NIDDK, diabetes, digestive and kidney, NINDS, neurological disorders, stroke and stroke, NIAID, allergy and infectious diseases, and other sources within the NIH include BARDA, an institute I briefly mentioned and we'll get back to, the FDA. Interesting, most people are used to paying the FDA, but they do give awards as well for orphan drug clinical trials, some phase 1 and phase 2. The DoD is another main source of funding from the government through different specific mechanisms and programs. And of course, there are also private foundations such as Gates, Michael J. Fox, JDRF, Komen, and others. Just looking at the NIH, as I mentioned, it's really the main source of funding, with its budget being about $30 billion of the $50 billion available, and with somewhere around $26 billion devoted for extramural research done outside of the NIH itself, such as research project grants and R&D contracts. To see where the money is being spent, this is data taken from the NIH's website looking at categorical spending, where you can certainly go as well to see how much is being spent in your area of interest. Just a few examples here. There's cancer receiving about $6 billion annually, by far the largest source of funding in the world. Neurosciences are close to that as well at $5.5 billion, and infectious diseases receiving, just from the NIH, not counting funding from Department of Defense or BARDA, over $5 billion. Of course, this is just a sample, and that long tail there includes many more indications and populations. Looking at the full development path, the NIH covers R&D activities anywhere from discovery stage through preclinical activities, IND-enabling studies, phase 1, safety, phase 2, efficacy, phase 3, pivotal, and then of course it lessens when you get to licensing and commercialization. What I hope you take away from this slide is that each stage of development is reflected by different solicitations and mechanisms. So there are mechanisms such as the R21, which we will touch upon later, and SBIRs, although that's more for US, so we won't be discussing them, and several others that are listed there. Regarding funding amounts, it's comparable to the amount of work, usually between $200,000 to $500,000. If you already have a more substantial body of evidence, you would probably be looking at other mechanisms, the R01, U01, etc. Then there are other mechanisms, of course, for late-stage clinical. The point is, you need to correlate your science's stage of development with what the mechanisms are able and looking to fund. Looking just at the foreign angle here for a moment, searching the NIH website for awards made outside of the US in 2014, there is funding for 1,245 projects awarded to non-US organizations, amounting to over $1.3 billion. In fact, at FreeMind, between 20 to 30% of our submissions are for non-US. Most importantly, chance for award does not reflect geography, but rather top science. You're reviewed for scientific merit, not for your location. A question we get a lot is why? Why would the United States want to fund non-US organizations? Well, if you look here at the NIH's mission, they're looking to seek fundamental knowledge about the nature and behavior of living systems and the application of that knowledge to enhance health, lengthen life, and reduce illness and disability. If the best solution is abroad, then you have as much chance as anyone. They're funding the best science and trying to address unmet medical needs. So they take this $30 billion and feed it to academics and industry and whoever qualifies in order to try and lower the healthcare burden. In 2014, the U.S. healthcare burden was $2.7 trillion, and it's expected to go up to $4.5 trillion by 2019. That is a lot of money. So again, they're trying to address unmet medical needs and lower the healthcare burden. When you do submit your application, there are a couple of differences, but the main one is that you'll need to provide a foreign justification to explain why a non-US applicant should be awarded a US grant. We've done this many times, and if the science is favorably reviewed, the review boards rarely have any issue with foreign justification. It's not a major hurdle. And if you look at the guidelines for foreign justification, you can see that they're looking for projects that present special opportunities for furthering research programs through the use of unusual talent resources, etc., or augmenting existing U.S. resources. So it may not need to be completely novel, but rather something that adds to existing U.S. resources. Of course, it needs to have specific relevance to the funding agency and to advancing the health sciences in the United States. A quick comparison of US to EU awards, as I'm sure many of you are familiar with European sources of funding. First of all, and I've said it before, you can win. We know this as a fact, and we have clients who have won. Compared to many national programs where there's a matching fund component, here there are no matching funds. 100% of the money is grant to go towards expenses related to your R&D, plus an additional 8% overhead. There are no royalty payments, you don't need to pay anything back later on. And this point here is actually quite important. Approximately 70% of awards are what's called unsolicited. Rather than answering a specific call, you present your science to the relevant funding agency using the investigator-initiated mechanism and will ultimately be reviewed and funded by the relevant funding agency. Again, this is about 70% of the awards that are unsolicited, and we will speak more about that shortly. No need for a consortium. Unlike European programs, you don't need to have collaborators from all over. And once again, it is science-centered, not a geographical or political question. Lastly, just to compare for a moment to the Horizon 2020 program, the Horizon 2020 budget is set for 7 years at about €3.5 billion per year, whereas NIH alone awards approximately €28 billion per year. So there are three main routes in accessing these non-dilutive funds. Solicited, where specific solicitations have very targeted focus areas. You can run a search. If the solicitation matches what you do, perfect. As I mentioned earlier, unsolicited or investigator-initiated, where approximately 70% of all NIH awards are unsolicited, with no specific call, focus, or specific request for a particular type of research. Or the third, which is kind of more general, usually there is a broad description of what an agency is looking for. So for example, Barda has a broad agency announcement, or a BAA, on the flu. So it's anything related to flu, with not a specific solicitation, but rather an area of interest. Now let's look a little bit at the National Institute of Health. If you go online and onto their website and you put in a keyword into the search box, you can see what comes up. You'll see the titles of each solicitation, the mechanism type, and you'll need to understand which of the mechanisms support early or exploratory, later stage, etc. I ran a search earlier today, a very general search, and found 1,021 solicitations. I've also pointed out here the link for the parent announcements, and if you follow that link, you'll see the investigator-initiated opportunities as well, 2 of which I'll share now, the 2 that are perhaps most widely used and from our perspective, the most important. The first one is the R21, the NIH Exploratory Developmental Research Grant Program, looking at earlier stage research. Technically, you don't even need preliminary data, although we would encourage you to have some in order to strengthen your case. Their budget is $275,000 for up to 2 years with 8% overhead, coming to $297,000. The next step, if you have a somewhat more substantial data already, is the R01, which allows you to ask for $500,000 a year, although you could ask for higher sums with pre-approval from the program officer about 8 weeks in advance. Now, the NIH has 3 major deadline cycles throughout the year, in February, June, and coming up now, October. The R21 deadline is October 16th, and the R01s are due in by October 5th. And now, I apologize if it's a little hard to see, but included here is a screenshot of participating institutes in the R01 omnibus mechanism. For example, there is NCI, NEI, NHLBI, etc., etc. The list is quite long. The purpose is stated here. The research project grant supports a discrete, specified, circumscribed project to be performed by the named investigators in areas representing the specific interests and competencies of the investigators. The proposed project must be related to the programmatic interests of one or more of the participating NIH institutes and centers based on descriptions of their programs. So our analysts who know these agencies inside and out can look at your pipeline of activities, look at your stages of development, and link that to the interests of the funding agencies. It sounds pretty simple. You just need to get to know the system and what each agency is looking for. Moving to the R21 omnibus solicitation, you can see that the list is a little shorter and there are some agencies missing. A major one I will point out is the National Cancer Institute, the NCI. But don't worry, it's because the NCI has their own R21 investigator initiated. And this is very similar to the description in the previous description, except that they're looking for early exploratory programs providing support for the early and conceptual stages of the projects. And most importantly, again, this needs to be aligned with the interests of one of these funding agencies. So this is right off the NIH's website, awards by location, non-US specifically. Anything over there in North America is Canada. And you can see there's a high number of awards in Europe, as I mentioned, in Canada, Africa, some in South America, Israel, Australia, really all over the world. Now, a well-known example of a nice hefty award received by a non-US organization is this $69 million awarded by NIAID to Crucell, a Dutch company a few years ago. And just a moment to look at the NIH review process. Putting it simply, in reviewing and considering whether to fund your science or whether to fund your application, the reviewers are weighing the strengths versus the risks. The way they do this is by first looking at 2 things, responsiveness and competitiveness. Are you responsive to the solicitation? Because no matter how good your science is, if you're not responsive to the solicitation, you will not be awarded. Although this is usually the easy part. Are you competitive? When you talk about competitiveness, we're looking at the significance of your research to public health. If it is innovative and will make a change. Do you have the right environment to support the work you propose? Do you have the right leadership and team in place to successfully lead such a project? Looking at the principal investigator, they want to make sure that the PI has the right expertise, knowledge, and experience to manage this project. And not just scientifically, also from a budgetary perspective. They're giving you the money and they want to make sure you know how to handle it. And the key personnel, who is involved and who will be overseeing which specific aim and making sure they have the right background to be doing so. But overall, the most important aspect they look at is the research approach, your scientific approach. They're looking at your milestones, your specific goals. Are they quantitative? Are they attainable? Do you have contingency plans just in case you don't meet the milestone? And ultimately, top-notch science wins awards. Looking now at BARDA, Biomedical Advanced Research Development Authority, an agency I mentioned earlier. The mission of BARDA is to develop and procure medical countermeasures that address chemical, biological, radiological, and nuclear accidents, incidents, and attacks, pandemic influenza, and emerging infectious diseases. Basically, anything that can hurt America, they want to develop and stockpile therapeutics and countermeasures and have quite a large budget to do so. They claim to bridge the infamous Valley of Death by taking Phase 1 completed projects that have, of course, shown solid preclinical data and have good safety profiles and move them forward, again in the areas of CBRN, influenza, and emerging infectious diseases. Here are 3 examples of BARDA solicitations, and while these particular 3 are currently closed, we do expect them to be reissued in the near future. They are all 3 broad agency announcements, which I mentioned earlier. One here is for the advanced development of countermeasures for pandemic influenza, one on CBRN countermeasures, and the third here is on science and technology platforms applied to medical countermeasures, basically platform technologies. These are all really great programs, and I'll explain in a minute how you get to them. First, a couple of examples of non-US organizations who have won BARDA awards. Here's Atox Bio, an Israeli company we're familiar with, that has won a $24 million award. And also we have here, of course, Leia Pharmaceuticals, I'm sure many of you are familiar with, a Swiss organization that took home an $89 million award. Back to how to approach this agency. First of all, BARDA is probably one of the most welcoming agencies. They are happy to speak with you, will meet with you, give you feedback on your work, and you should definitely get in touch with them to try to understand their needs and interests prior to trying to submit. What you can do is go to their website and sign up for what's called Tech Watch. And you can set up a meeting with them, either in Washington or via a conference call. They'll give you feedback on whether they are interested or not, if they would be interested, if you have some slight changes to make your science more relevant, well, making sure at all that your science is relevant and appropriate for what they're looking for. When you look at BARDA and also the Department of Defense that we'll get to next, it's usually a 3-stage process in comparison to the single submission with the NIH. The first step is the white paper, or the pre-proposal. Usually limited to no more than 10 pages long, this is really the most difficult part to get past. But if you do, within 45 to 90 days, they will ask you to submit a full proposal. Unfortunately, you only have another 45 to 90 days to do that, so you really need to hit the ground running. That will then be reviewed for technical merit and enter into contract negotiations. If you've gotten to the contract negotiation stage, you're pretty much sure to receive the award. Now, while BAAs typically have no budget cap, you shouldn't go crazy and ask for $1 billion. On the other hand, don't be afraid to ask for $20 million if it's justified. Ask for what you need. If you ask for too much or for too little, they'll question if you really know what you're doing. Now, as I mentioned, we're going to look at the Department of Defense with 4 agencies or mechanisms that are most relevant for funding R&D in the life sciences. Starting here with DARPA, Defense Advanced Research Projects Agency, a very interesting agency. Not only life sciences, they look for multidisciplinary approaches to advanced technology. Basically, they look at a project with only a 2% chance of being successful. These are for crazy ideas with great potential. We sometimes compare them with Q from James Bond to give you an idea of the types of projects they fund. Then there's DTRA, Defense Threat Reduction Agency. They focus on safeguarding the U.S. and its allies from weapons of mass destruction, whether bugs or chemical warfare. And then there's USEMRIC, U.S. Army Medical Research and Material Command. Through the U.S. Army, there are different funding sources and mechanisms available to support different aspects of R&D that may or may not be relevant for military use, such as wound healing, pain management, TBI, and other such fields of research that relate to soldiers. Under the DoD, the most interesting mechanism for the general life science market is the CDMRP, Congressionally Directed Medical Research Program. They're not looking for specific military use research, but rather they fund research that relates to veterans and the families of military personnel, basically opening it up to the medical needs of the general population. To give you an idea, here's a list of specific research areas they had in their 2015 program. And they funded large amounts of money for both early stage and late stage clinical research. However, unlike most of the DoD that works with ongoing BAAs or the NIH with 3 deadlines a year, the CDMRP is an annual event. They issue their specific solicitations around March or April, and there are specific deadlines for each one. Now, most of the programs here listed are already closed, but this is definitely a very important and interesting source of funding that many people are unaware of. So just a couple of examples you can see. We have breast cancer had a budget this year of $120 million, spinal cord injury at $30 million, Alzheimer's and Parkinson's, $28 million, and of course there are many more on the side and others that are not listed. Again, non-US organizations are eligible, and we recently helped a Danish client win in this mechanism. Now, just from a more broad perspective, I'd like to take a step back and give you an idea of our approach to non-dilutive funding and how to maximize your chances for award. First of all, know the interests of the agency. What's on their agenda? What are they looking to fund? If necessary, communicate with the program officers. This is extremely important and valuable. You'll need to focus your project application. Focused applications have a higher chance of being favorably reviewed. Remember, the NIH does not fund companies or labs. They fund projects. You don't want your proposal to come across to reviewers as overly ambitious or unrealistic. Again, make sure to ask for what's necessary. Don't inflate the budget or ask for too little. Having an accurate budget shows that you're realistic and understand your project. Make sure to present a complete project. And leverage on research collaborations. Whether or not the mechanism requires it, or in case where there's a gap in your capabilities, it's important to collaborate. Take on consultants, statisticians, or outsource work you're less proficient at or don't have the expertise or environment to complete. Next, I'd like to emphasize the need to target the right mechanism. As I'm sure you understood from the previous slides, there are many industry-oriented solicitations out there working through various mechanisms. It's very important to know your way around these mechanisms as they represent more than just letters or numbers. There are several different pockets of money for industry as well as academic industry collaborations, and you'll need to identify and target what is best for your project. It's vital to understand the different sizes of awards and the success rates, know the different funding levels, and match them to your requirements and needs. And of course, conduct a thorough strategic assessment. Look at your objectives. What are your research projects and what stage are they in? Where would you like your research to be in the next 12 to 24 months? And what is the potential for success in each of these research projects? All of this should be done with the goal of creating a multi-submission granting strategy in order to increase your chances. I'd like to conclude with a little bit more about the FreeMind professional team. We have close to 50 full-time employees made up of, including our analysts and managers or writers. We have a team of analysts and a large team of grant managers or writers. And then looking at our services, this is a brief summary of our professional process, where the first step is a strategic assessment. Our analysts will get an understanding of your pipeline, your goals, your funding needs, short and long term. We'll identify all of the relevant opportunities available to support your science, and together with you, create a multi-submission granting strategy. We then move on to the project production process, where our grant consultants or our writers will work with you together to create the most comprehensive and best possible application for each of the opportunities you would like to pursue. Here's another schematic just to show you how we work, starting with your R&D needs, moving into creating grant production, multi-submission, and working out the granting strategy. Just keep going until we've targeted all of the different opportunities available. Again, we don't write the application for our clients, but with our clients. It's a ping-pong back and forth, ongoing feedback aimed at ultimately generating a single coherent presentation. Once we both feel the application is the best it can be, it is submitted. Thank you very much for your time, and here is my contact information. Again, I'm very happy to speak with everyone or anyone over the phone to discuss specifics related to your organization. Thank you very much, and we look forward to having you at our next presentation.